Hi, I'm Maureen Bisognano, and I wanted to talk to you today about something that I have a great deal of passion about. A few years ago, at one of the international forums, I was talking about an article that I had read by Susan Edgman-Levitin and Michael Barry, and in this article, they challenged us not to think of a patient only as a diagnosis or a clinical problem, not only to say, what's the matter, but also to say what matters to you. I challenged people to go back to their organization and talk to patients in this new way, to not only say what's the matter, but also ask what matters to you. What delighted me was that nurses and physicians from around the world took me up on this challenge. The first was a nurse in Glasgow in Scotland, Jen Rogers, and she went back to her hospital and gave children a piece of paper and asked them to put their name and their age and say what matters to you. This is an example of one, and there are many all over the office here at the Institute for Healthcare Improvement that describe what's so important to these children. I hope that all of you will have the opportunity to go out and ask a patient, what matters to you? What you'll find is that what matters deeply to people often is different from what we might clinically diagnose them, but it expands our view, our sense of what is really important in these people's lives. What matters to me is making a difference in someone's life. It gives me meaning when I can reach out and help. It's why I came into healthcare. It's why I've been teaching in healthcare for so many years, because I think that reaching out with gratitude and making a difference in someone's life actually comes back in a very positive way. On June 6th, 2017, we'll be celebrating around the world What Matters to You Day. What these nurses and physicians started some years ago is turning into a global movement, and I hope you all will join us on that day.